like to thank you all for coming to hear about this, what has been a very exciting journey that we've undertaken. And I must admit, when we first put in our proposal for a Jisc project, which was our first, I didn't expect it to be how it was. I didn't expect the level of technology that we would need to be able to communicate with some of our partners. So it's been a steep learning curve, but I think we've mastered a lot of the lingo now. Although things have changed over the last few months, when we started this project, the political, social, economic landscape was completely different. And I know that you've all been through these journeys. My name's Lynda and I work for the NHS, and I'm sure people are aware of all the changes happening in the NHS at the moment. If I can get my colleagues to introduce themselves.
Hi, I'm Dr. Julia Brown. I'm from Aston University. I'm the Director of Business and Marketing there in the School of Life and Health Sciences.
I'm Sue Woodward and I'm the HE Manager that actually performs every function to do with HE within the FE College of Birmingham Metropolitan College. We've gone through a great period of change with merger of four colleges coming together as one, period of redundancy, and that's the sort of landscape that the project's been moving through, so we've had to manage that. And we're both members of the Midland House Academy.
And our changes in HE are yet to come. We'll find out in October what our cuts will be.
So throughout the project, things changed. And when we filled in the risk analysis at the very beginning, we knew there was going to be a general election at some point. What we didn't expect were the radical changes. So I just want to frame the project against that background of redundancies of key staff in the project, which means we've all been scrambling around trying to cover the skills that we were missing. I will stop this.
I'm not saying I wanted us to pause on that particular photograph, which I think is probably the worst of any have been taken on the project.
Okay, we called our project the Response Project. Although we're under the data security theme for this presentation, our project was very much based on collaboration and partnership, and that for us was the key, and the whole issue of knowledge exchange rather than transfer between the NHS and academia. What we're going to do is briefly look at the background to the project, look at steps to success, the things, regardless of the political landscape we found ourselves in, the steps that we took that made the project successful, what actually happened, and then briefly look at sustainability because of the changes that we're experiencing. So the purpose of the project, and Di went through this morning, so I'm not going to dwell on it, it's to support institutions' engagement with the wider community. Very much for us, the focus of the project was on this highly skilled workforce within the NHS. And two parts to that, our existing workforce and our future workforce, and working with the academic partners in order to ensure that the products we were getting were fit for purpose for a changing landscape within the NHS. Changed even more now. Employer engagement from an academic perspective is essential. And Ramsay MacDonald said the skills issue will only work if driven by employers. So that was very much the thinking behind our partnership in the first place as the Midlands Health Academy, but also how we could use online collaborative tools to strengthen the partnership and to widen it within all our partners, because face to face we were meeting the same people. Online tools allowed us to widen our pool within each institution, which I think added to the success. I can hand over to Julia.
Okay, I'm going to do a very brief introduction to Midlands Health Academy, and I'm going to talk to you about the historical background of Midlands Health Academy. How it started was the Chief Executive of the Heart of Birmingham Teaching Primary Care Trust approached some of the education providers in Heart of Birmingham to see whether or not they would be willing to work together to provide the education and training that people needed to work within the NHS. So he approached Aston University, he approached Matthew Bolton College, and he approached Birmingham City University. And at that time we all got together and decided, did we want to be involved, did we want to work in partnership, which means collaboration rather than competition. And that was a major step forward in saying, yes, we do want to work together in collaboration and we can provide. And we had sufficiently different portfolios that we could work together like that. Well, we've survived a number of things over the years. We've survived Matthew Bolton College merging with Sutton Coldfield College, and you can imagine the restructuring and the loss of posts that have gone on since that merger. We've survived a number of different things like Birmingham City University, where they've had to reapply for their jobs at certain levels, and we've lost people. So from our original Midlands Health Academy steering group, only 2 people survive, and I'm one of them. And Will Murdoch, who's a GP from Heart of Birmingham, is another one. And he was going to be here today, but he's not. So I'm just the one surviving member that you'll meet. But we've survived a lot, and we decided there's so much work going on, especially with all our community engagement projects that we had, that we needed somebody on board to work with us. And that's when we appointed Lynda as our project manager to work with us and keep us all together. But our community engagement is really a sort of vibrant part of the whole Midlands Health Academy. We've had money from the Lifelong Learning Network, we had £85,000, and we generated a website, which is basically the Skills Escalator web tool, where people can come in, look at what skills they require to jump up the ladder or sidestep into a new role within the NHS. And the partners all have their various course materials, information on there, so that people can look at what training is available. When Lynda came on board, which was 2 years ago now, we acquired another 3 partners. So we've now got Walsall College, we've got South Birmingham College, and we've got University of Wolverhampton. So we cover a reasonably wide area. And we still have the same mandate, even though the political landscape is changing. We're still really trying to educate the people in the community to get a sort of widening participation, to bring more people into the NHS, and to have a workforce that represents our local communities. I'm sure you know Birmingham is like the world in one city. So there's lots and lots of different groups in Birmingham, and we don't really represent currently. We also have the ageing workforce, and a lot of people are about to drop off in the ageing workforce that we need to replace. So we're all about working together with the employer, looking at workforce development and trying to tailor our educational provision to the workforce. I think I'll hand back to Lynda.
Okay, so the context that we started the project with was the NHS employs 1.4 million staff in England alone. It's the biggest employer in Europe. However, 62% of the workforce are not doctors, nurses or other healthcare professionals. They're admin, managerial. Workforce planning traditionally is always focused on doctors and nurses. So when we're looking at our ageing workforce, we know that although it's 10 years for a doctor, we do our plans 10 years before we know those doctor posts are required. It doesn't happen with senior managers or any managerial roles. How are we going to plan for succession for the admin staff as well as other health professionals who aren't part of the SHA workforce? So what we did was say workforce plans that HOB, Heart of Birmingham produce, and other NHS trusts are not being shared with our academic partners. So how can we really do any knowledge exchange around workforce development unless we're saying what workforce we require? How can academia plan otherwise? So knowledge exchange, and again, Di went through this, it's how higher education and further education interact with external organisations. So what we did was went out and spoke to all our MHA partners, asked them if they wanted to be involved in this project, made it clear there would be a time commitment. But again, this was at the beginning of last year and things were very different. We then looked at laptops because a lot of our partners, and Julia was in India, I think, for one meeting, a lot of our partners do travel. We wanted them to be able to come to online conferences, use the framework, the sites that we'd set up, wherever they were. And then choosing the project team. Now our skills are not technical, so choosing the right people from Birmingham Met to drive the project and drive the technology was crucial, and we did get the right people. And then we sat down and we thought, which collaborative tools do we actually want to test? The project team, for the non-technical staff, we said to each institution, we want someone with knowledge of clinical and non-clinical courses, someone who understands the NHS, and someone with understanding of workforce planning. And that really opened up for us access to people that we hadn't met in those institutions before. When we were looking at the tools we were going to trial, we sat down and said, okay, what requirements do we need? What do we need the technology to give to us? And it was document sharing, it's knowledge exchange. We were going to be sharing documents. We wanted forums. So if a partner had something really, wow, let's start a forum on it. And we wanted online chat facility. We also wanted online conferencing, and we wanted to be able to record the presentations that we were giving online. So that was a pretty tall order,